as recently as when the pandemic was announced, that would be around March of 2020, is when I became increasingly concerned about my own health and really did a lot to be consistent with the walking and also spending time in Karura doing some exercises.
45-year-old Munge Washira has lived with type 2 diabetes for nearly 20 years. But the prevailing COVID-19 pandemic has made him more concerned about his condition.
When the pandemic started, one of my greatest fears is that people who have pre-existing conditions like diabetes or hypertension were more prone to more severe COVID attacks. So at that point in time, of course, there was a feeling of fear that drove me and said, I have to be healthy. I have to be on an upward trajectory in terms of the weight loss and maintain the weight loss, and also ensure that my sugars are very, very well controlled. And that has been, that I've been able to achieve.
I met with Munge's doctor, a specialist in diabetes treatment, to find out more about the impact of COVID-19 among people with type 2 diabetes.
The fact that you have diabetes, and for this matter, type 2 diabetes, doesn't mean that you are more predisposed or you have a higher chance of getting COVID, okay? The problem comes in when you get COVID and your diabetes is not well controlled. In this case, when your diabetes is not well controlled, then we are seeing patients getting more complications.
Diabetes is a chronic disease that occurs when the pancreas does not produce enough insulin or when the body cannot effectively use the insulin it produces. Insulin is the hormone that regulates blood sugar, and irregular blood sugar can cause blindness, kidney failure, heart attack, stroke, and lower limb amputation. There are different types of diabetes, but according to the World Health Organization, over 90% of people with diabetes worldwide have type 2, which, as in Munge's case, is often caused by excess body weight and lack of exercise. Currently, about 60 million Africans have diabetes, a worrying statistic as the continent faces a 153% rise in type 2 diabetes over the next 20 years. In Kenya, nearly 1.7 million people have diabetes, but data by the country's Ministry of Health reveals that about 44% of Kenyans with diabetes do not know they have the condition. Some experts, however, believe that a low-carbohydrate diet can help reverse type 2 diabetes.
The ketogenic diet is a very powerful tool towards reversal of type 2 diabetes. The only issue with a ketogenic diet is the way people do it. However, scientifically speaking, if you do it correctly, then you will see a very good percentage of people reversing type 2 diabetes with ketogenic diet.
Diabetes remission means a person's blood sugar levels are healthy without needing to take any diabetes medication.
One of the main factors that we look at when you're looking at an individual progress is how they have lost weight. Munge has dropped, I think, from 83 kilos to 63 now, and his target is 60. And yes, he's currently in total remission.
I have been off medication now for 1.5 years, and like I mentioned, this was instructed to me by a doctor because there was an assessment of my blood sugars. There's something called glycated hemoglobin that checks how long someone who is diabetic, in the last 3 months, how well their sugars or how poorly their sugars have been performing, and the doctor is able to determine whether you can actually get off medication and use diet and exercise alone to manage the condition. So there's always a risk that if you're careless with your diet, if you go into a carbohydrate dense diet and taking a lot of alcohol, it may impact negatively on you, and you may progress from tablets to insulin, which would be a very, very sad state of affairs.
Some food scientists, however, warn that cutting off carbohydrates completely could bring on other serious diseases.
If you eat more fat and eliminate carbohydrates, which most of the keto diets, for example, advocate, most of the animal fat are what we call bad fat or trans fat, especially the processed fats. In most processed foods which we are eating right now contain that. So what happens, you have more incidences of now hypertension and other cardiovascular diseases, heart diseases, you'll have cancers, and you'll have stroke. And that's why for me I call it a balance. So if you eat too little of something, you get a deficiency. If you eat too much, you get a toxicity. And that's why we've established recommended dietary intake for most of the nutrients in terms of even food servings per group.
In addition to observing a strict diet, Munge often walks several kilometers in a day to help ease his pandemic-related anxieties.
Right now I feel good. Even I can say my mental health is much better. My thought processes are clearer. I sleep better. You know, I just feel like a much more wholesome person than I was before.